Victoria, and as you put it, we are live now for the Citizen TV Town Hall. We are at the Panari Hotel along Mombasa Road. And of course, let me give you some history, some background to this topic. Now, back in 1969, the first president of Kenya, Jomo Kenyatta, dismissed traditional healers as quacks, as charlatans. And over 50 years later, his son, our now president, Uhuru Kenyatta, has a different view on herbal medicines. In fact, on the 30th of June 2017, President Uhuru Kenyatta signed the 2017 Health Act into which basically directed the formation of a body to regulate the practice of alternative medicine in Kenya. Well, the Ministry of Health still has not fully carried out that particular directive, and we tried to find out why from them today we were not able to. But nevertheless, the topic of herbal medicines is an important one in this day and age as you reflect on that two-part series, Ghost of Loliondo, that aired, with part 2 airing today on our program. That's a discussion we're having today here with our panel and our audience as well. Let me briefly introduce our panel to you. I'll start from my far left, where we have Dr. Waraka Mwamlole, who is a consultant general surgeon who has practiced not just in Kenya, but also in Botswana as well. He joins us for the program. Karibu sana.
Good evening, viewers.
Right here next to him is Martin Odhiambo, a herbalist who has also done quite some work at the Botanical Gardens at the National Museum. He'll be telling us more about that. Martin, welcome to the program.
Thank you very much.
We also have Professor Jennifer Orwa, who's a fellow of the Pharmaceutical Society of Kenya and a research scientist at KEMRI. Professor, welcome to the Monday Town Hall.
Good evening, viewers.
And last but not least, we have Dr. Peter Ikamati, Deputy Director with the Directorate of Product Evaluation and Registration, Pharmacy and Poisons Board, and also a World Health Organization consultant. Dr. Ikamati, karibu sana.
Good evening, viewers.
Yes, and as always, we never do this show alone, or I never do this show alone. Mashrima Kapombe is here with me. Mashrima.
Asante sana Waihiga, umesema sawa kuwa swali kuu hii leo ni kuhusiana kama ni mitishamba ama dawa za kisasa, na huku baadhi ya watu wakihisi kuwa mitishamba haiwasaidii. Kuna wengine wanaapa kuwa bila tiba ya mitishamba basi hata wangekuwa hapa. Na nataka tu kuanza na Jeremiah Murioki Madhenge, ambaye anafuatilia tu kutoka kwa ile taarifa ambayo iliweza kupeperushwa na Pamela Asigi pamoja na Jamila Mohamed, hekaya za Loliondo. Yeye alikuwa kwa Loliondo na anahisi kuwa imani yake ilimponya. Hebu tumpatie nafasi sasa aweze kutueleza. Jeremiah, ulienda Loliondo mwaka gani?
Loliondo nienda 2011. Sikumbuki ni mwezi gani.
Na ulikuwa unaugua nini wakati ukienda huko?
Nilikuwa na very acute ulcers. Nilikuwa hata kama ni kwenda choo naenda damu, kuhara na hara damu, hata kusikia tu when you are flying kitunguu yenyewe inanifanya kwanza nitapike. Na always ni damu. Kwa nimelazwa Tagakani, nilikuwa nimefanywa several endoscopies Tagakani. Hata ile mandawa nilikuwa natumia kama Leosegel, even affected my teeth. Yaanza tunao inaanza kuisha mpaka sasa ndio ikawa foundation.
Na ilikuwaje paka ukasikia kuhusu Loliondo? Safari ilikuwaje hadi ukafika huko? Tueleze.
Mie handi
Tafadhali tumsikie si wote.
I heard about Loliondo in my friend's office, where some friends of ours had taken their father to Loliondo from Kakamega. So they told me about the issue. I came and discussed it with my wife. She told me also she had a hand. So we had to arrange to go to Loliondo, where we understood there was a booking office for Ford matatus at Kayole. We went there and booked for a matatu where they were charging us 2,500 return. And we went to Loliondo. The next day we got to Loliondo, where we went to Babu's place. First and foremost, he started with a word of prayer. He was a Christian. He told us that he had a vision that he should heal people with those herbal concoction. So since we are so many people, he told us that we have to go back to our vehicle after prayers. We will be served from our vehicles, because it was a very big queue, about over a kilometer. It's about 2 kilometers away. So we went back. And we had also instructions. When you are served, you pay 100 Kenya shilling. That money, he told us, is not selling us the concoction, but for the fee, for the services for those he had hired servers. So to me, I did not hear him say that we are paying for the medicine, but he had given us instructions. If you are under any medication, continue with it. And those who have taken this medicine of his, you will take effect after 4 days.
So you came back home after 4 days. Was there a difference?
After 4 days, me had forgotten, because even when I was in Loliondo, I was in a lot of pain. So one day, after supper, I started vomiting. I vomited a lot, especially I vomited and twisted to vomit blood which had clotted. Even I had to be supported by my daughters to wake me and fall in the toilet. So when I went back to sleep, in the morning, thus I remembered we were told about 4 days and the 40 days. So I celebrated and been cured. And for sure, ever since then, I have never vomited blood. I have never had ulcers. Even today, I eat piri-piri. I eat together, which I was not eating. So, me, I believe. I don't know whether I was healed because of the belief, because even the driver we used to go with, who took us to Riondo, I shared the front seat with the cabins with my wife and him. He had also suffered from gout, and he was showing us that he had gone there the previous year, and it was just only something small which was remaining. So by the time we were going to Riondo, I was almost healed because I had a belief, and I did it.
Hai, asante sana. Jeremiah anasema hajui kama ilikuwa ni ile dawa ama ni imani ambayo ilimponya. Lakini kuna mwenzake hapa, Doreen, pia wewe ulikuwa Loliondo. Experience yako ilikuwa sawa na yake?
No, experience yangu ilikuwa sawa na yake.
Wacha tuanzie mwanzo. Ulisikia kuhusu Loliondo mwaka upi na ulienda safari na nani?
Nilisikia kuhusu Loliondo mwaka 2011 na nilienda safari na mamangu. Mi naishi na virusi vya ukimwi, miaka 27 sasa, nilizaliwa navyo. Kwa hivyo wakati nilimuona babu wa Loliondo kwenye TV, mimi nilijua kwamba this is the person, like mimi nishapona. So nikamconvince mamangu, akaniambia sawa twende. So akaenda akachukua loan pale kwenye sako yao, afu tukaenda Loliondo. Sasa tulipofika Loliondo, tulitumia fare ya 10,000 each. Tukafika Loliondo, tukaingia kwenye kiu ya magari, afu kisha yake asubuhi tukapatana. Sasa baba akatuta kwenye compound yake, akatuongelesha, akatuambia mimi sina tiba, ila tiba iko kwa imani yenu. Na kwa sisi kusafiri kutoka Kenya hadi Tanzania, imani tulikuwa nayo.
Kwa hivyo ulikuwa na imani kuwa
kabisa. 100%.
Baada ya kunywa kile kikombe, ukarejea Nairobi. Hali ilikuwa vipi? Baada ya siku 4 kama Jeremiah, ulihisi nafuu?
No, mimi nilipotoka Loliondo niliamini nimepona. In fact, babu alikuwa atuambia kabla ukunywe kile kikombe, say a word of prayer afu kunywe. So mimi nikasema tu ombi langu, afu nikajua sasa hapa HIV bye bye. So tuliporudi Nairobi, tukakaa atukwa tunakunywa dawa, tuliachana na dawa. So baada ya miezi 3 mamangu akaenda akapima, afu akapatikana baada ya ku positive. So akaniambia itabidi turudi kwenye dawa zetu. Mimi nikakataa, nikamwambia ngoja labda na take time. So tukaacha. Nilipofanywa viral load test yangu, viral load yangu ilikuwa 200,000 copies. Hiyo iko way above, yani haifai kwa hivyo. So nikauliza na daktari, nikamwambia mimi sijui nini kinaendelea, labda uniambie wewe. Akaniambia lakini inaonyesha either ukunywe hizi dawa ama hauzikunywi wakati unaostahili. Kaambia dawa na meza tena kila siku.
Kwa hivyo kumdanganya daktari.
Yeah, nikamdanganya daktari. So daktari akaniambia itabidi ume-adjust masaa yako ya kunywa dawa.
Na ilikuwaje sasa hadi ukarejea kwa zile dawa zako za awali za ARV?
Baada ya viral load yangu kupanda, niliacha kabisa kwenda hospitali kwa miaka 2. So from 2011 nilikuja kurudi karibu 2013 wakati nilipopata pneumonia kama opportunistic infection. Ndipo sasa nikaona kweli reality hakuna kupona, wacha tu nirudie kwenye ARVs zangu.
Naam.
Yeah.
Asante sana Doreen. Wahiga.
Mashirima, asante sana. They say there are two sides to every coin. You've heard of the two sides of Loliondo. One, a story of success and happiness, challenges, dealing with a stomach issue, which they say was solved after taking that drink. But another who says that Loliondo did nothing for me. But we want to broaden this discussion and talk about herbal medication. What has been your experience? 2242 is our SMS line, and the hashtag is Monday Report. But Dr. Waraka, who is a consultant, general surgeon, I want to actually start with you. You initially believed that herbal medicines were maybe overrated, maybe inefficient, but with time, you say you are beginning to change your mind. Why?
Thank you. I'm a conventional doctor, and I know when I get an illness, first of all, I have to find what it is very accurately. So I'll take the history, I do a physical examination, I do investigations, which may include x-rays, CT scans, and so forth and so on. Get a diagnosis, and then know exactly what it is, and I go to a specific treatment, which I know what it is, its detail, its chemical nature, and everything, and I treat the person. Or surgery, which I know what I'm doing. But the herbal side was shrouded in mystery.
Mystery. Mm-hmm.
And I could not choose it as a way for a long time. Well through my practice, up to when I was in Botswana, that's when my patients are the ones who made me have a certain paradigm change.
Give us a specific example of one patient who came to you and changed your mind about herbal medicine.
I think I'll give you one I found in Kenya. And up to now, I was like still, despite the experience I had in Botswana, still not trusting herbal medicine. Then a gentleman came, and I got his permission to mention his name. And today I'll do that because he gave me his permission. He says, tell them so they can know. He's actually a very senior fella. He's Dr. Nelson Makanda. He's the Deputy General Secretary of the NCCK.
Okay.
He came to me and we diagnosed cancer of the breast. Cancer of the breast. So I took him for surgery. I operated at the Karen Hospital and prescribed the treatments of chemotherapy, radiotherapy. He also went to India to check whether the cancer I'd operated was completely. When he went there, he was told by PET scan that I'd done a good job, thank God. And when he came back, I was following him up for chemotherapy, radiotherapy. After a while, we checked him, did a PET scan, that's why after 1 year or two. I told him, you're doing very well. There's no cancer spread anywhere in your body. So your chemo is doing very well. He said, no, I've never used your chemotherapy. You don't? I said, you better start using. He said, okay, second year, third year, fifth year, now he's on sixth year. He's never used chemotherapy or radiotherapy.
What is he using?
And he has no metastasis, no spread of the cancer anywhere in the body. Now that made me begin to wonder. Now say, what are you using? Now you see, I start asking. He's strictly on nutrition and certain herbs, and he names them. There's one called soursop. I think the herbalists will know about that one. And another one, mainly the soursop is one I remember that he's using. So I said, this is very, very interesting. We need to start engaging with the herbalists or the plant medicine doctors and do research and collaborate, because there's a place for it.
There's a place for that.
This is what I'm thinking, but I still would like it done in a way where mystery is not there, demystified herbal medicine.
Okay, and we'll get more from you on that. But I want to bring in Martin Odhiambo, who has introduced himself as a herbalist. Yeah. How does one become a herbalist? You see, we have professors here, we have doctors. We can trace that qualification to an institution or so forth. When you call yourself a herbalist, where are your qualifications from, in a sense, and what standard do you use? Because one of our audience members here was concerned that herbal medicine is unregulated. Anyone can give you anything.
Okay, thank you very much. I think most of the people, they don't get the meaning of herbal. Because I wondered when you ask them who has not used herbal in his or her life. Some people say they have not used it at all. Mm-hmm. But I think the tea they take is herb. The vegetable you take is also herb. So I'm wondering why you are saying you don't use the herbs. No. So kuelewa kuhusu miti shamba ndio ngumu. Matumizi yake pia kuelewa yanakuwa ngumu. Hivyo sasa kile kinafanya uitwe daktari wa miti shamba ni kwamba kuna vile ulianza, sio kwa kusoma. Kuna wale wanasoma wanajiita daktari, bali kama mimi sasa mimi sikuisoma. Mimi naye nilikuwa nafuata vile babu yangu alikuwa akifanya tukienda kuchunga ng'ombe. Nyanya yangu pia alikuwa anafanya yake, uvichi ile mimea alikuwa anayatumia wakati huo, yote nayatumia mpaka wa leo. Kwa hivyo kutoka hapo nilianza kuweka hiyo kitu in practice. Mm-hmm. Kwanza nikaanza na mimi binafsi. Nikiwa na changamoto za shida za tumbo, najua nachuna mmea gani. Ikiwa ni kutafuna natafuna. Ikiwa ni infuse kwa maji nafanya the same. Hiyo shida inatatulika. Ikiwa nime lose appetite, same, kuna mmea najua na enda mmea fulani natumia kwa appetite. Mm-hmm. Yes. So okay. Kutoka hapo nikaifanya kama routine.
Na ikakuwa kazi yako sasa. Ikakuwa kazi yangu. Hebu nielezee hivi.
Yes.
Can herbal medicines treat every and any ailment, or is there a limit?
Okay. Tukiangalia mimea. Mm-hmm. Mimea yako kila aina. Matawi ukiangalia yako tofauti. Vile vile magonjwa pia yako tofauti. Hatuwezi sema kwamba mfano nitumie sukuma wiki. Hatuwezi sema kwamba hiyo ni mfano tutumie sukuma wiki kutibu malaria. Ilhali kuna spinach pale pia. Kwa hivyo dawa ya miti ikiwa ni moja mfano sukuma wiki, iwezi kuwa inatibu magonjwa yote kwa mwili. Kuna ile inatibu kwa njia ya haraka kuliko nyingine. Kwa hivyo madawa ya miti sio moja inaweza tibu magonjwa yote at once.
Okay, asante sana for that. We also have Professor Orwa, a fellow of the Pharmaceutical Society of Kenya, but also a research scientist with KEMRI. Professor, tell us this. According to any KEMRI studies that have been done on matters herbal, can you conclusively say that herbal medicines work? If someone was to ask you a question like that, I know it's not a scientific question, it's a layman's question. Would you be able to give them a yes or no answer?
I would give them a yes answer.
Yes.
A yes answer.
Backed with data.
Backed with data.
Okay.
Although most of the data is preclinical studies, we normally start with the herbalist and ask them to tell us what they use and how they are using it. So actually the Center for Traditional Medicine in KEMRI was started just to, as my colleague says, to demystify traditional medicine and also provide some evidence of the safety and efficacy of these traditional medicines.
Okay. Last year, KEMRI, in a sense, scared the country by reporting that herbal medicine sold in major towns in Kenya are highly contaminated and dangerous for human consumption. And you did a survey that covered Nairobi, Mombasa, Eldoret, and this was reported in the press. How concerned is KEMRI about the safety standards of the way in which herbal medicines are dealt with by people like the gentleman next to you?
Very, very concerned. let me say that even in our conventional medicine, if they are not handled well, certainly they will lose their activity. Manufacturer can produce very good medicines. You go and keep it under conditions which it can't be working anymore. It will have contamination. And so is herbal medicine.
Okay.
What the research done at Cambridge, you see, these herbs were picked and then displayed normally where there is a lot of dust, not kept properly, not dried properly, and of course they will be in have a lot of contamination.
Okay.
And that is the challenge we have with our traditional medicine being marketed on the streets without control.
So it's not just about their effectiveness, but also how they are stored. Yeah. I want to open this up to the audience. I know I also have Dr. Peter Ikamati with me here, and I'll give him a chance shortly to speak to us on what they are doing as the Poisons and Pharmacy and Poisons Board in terms of possibly regulating herbal medicines as well. But before I allow him to speak, I believe there are many questions from our audience here, and Mashirima will help to pick up some of those. Mashirima.
Kabla ya hilo swali moja, kuna mwingine hapa ambaye experience yake ni tofauti kutokana na kile ambacho ameona. Make profesoro amesema kuwa dawa za kiasili zinaweza kufanya kazi wakati wote, lakini huyu experience yake iko tofauti. Patrick.
Good evening. So my name is Patrick, and I had this childhood friend of mine who had stomach ulcers. Then her parents had tried to purchase the drugs from the hospitals, and unfortunately the drugs did not produce the desired results. So they instead tried some herbal medicines, and the herbs made the already bad situation worse, as in she began vomiting and having some extremely severe stomach upsets. So how can we really tell that this is a credible herbalist and this is just a scammer who wants money? Like, it's so difficult as compared to the professional drugs whereby we have the criteria.
Okay, that's a good question. Asante.
Wacha kuna swali lingine Waihiga kabla sija kupatia nafasi kuhusiana na hilo jambo ambalo ulilolitaja kuhusu namna ambayo dawa za mitishamba au madaktari wa dawa za mitishamba wanaweza kudhibitiwa. Faustin.
My name is Faustin Juma. Mine is to talk about the role of the Kenya Industrial Property Institute working in conjunction with the KEMRI to make sure that these traditional medicines are fit for human consumption. We have an area in intellectual property law known as patents, which requires that these traditional herbalists should patent these traditional herbal medicines. So my question to Madam, do you recommend these traditional herbalists after doing after doing a thorough analysis of these drugs to see if they are fit for human consumption? So do you encourage them to patent them?
Okay, thank you. Good questions that have come in from our audience, and we'll get some more as well. But I think let me start with Dr. Ikamati, who is from the Pharmacy and Poisons Board. And Dr. somebody asked, how can one tell a herbalist who is actually trying to improve the lives of others versus one who is in it for pure profit? And where does the Pharmacy and Poisons Board come into all this? Do you, for example, have any ideas, the Pharmacy and Poisons Board, how many herbalists there are in Kenya? Must they see you at any point? Give us that as the background as you seek to answer that question.
Thank you. The first thing I'll tell you, the role of the Pharmacy and Poisons Board. The Pharmacy and Poisons Board is the National Medicines Regulatory Authority, and our work is to control the use of all medicines, medical products and health technologies in the country. And herbal products is one of the medicines that we're supposed to, or we do control. Now, in Kenya, today, what we've been having is that the practice of by the traditionalists is held by a different ministry, which is the Ministry of Sports, Culture, and Heritage.
So tradition is a part of Kenyan culture.
It's part of Kenyan culture.
If you look at the ministry that they fall under.
Yes. So it is in the wrong ministry, but the government has looked at it, and through the Health Act 2017, it has been proposed that the Ministry of Health comes up with authority or regulatory authority for the control of the practice of herbalists. Get in mind, this will be like the Medical Practitioners and Dentists Board, you've got Nurses Board, you've got the Radiologists Board. So they'll be controlling the practice of these professions. Now, the other thing in Kenya that we're lacking is that herbalists, we don't have a minimum standard. How can we measure their training? What is the threshold? What do we need? I think with the establishment of this regulatory authority for the control practice of herbal medicine, I think these are the standards that need to be put in place.
But of now, you cannot tell him whether A is good and B is bad. We
cannot tell. And what we've found out within our market is that, well, some of the herbalists could be good, but their profession, their products are not science-based. I'm trained as a scientist. I want to see, and my area is medicines development, conventional medicines development, but currently working as a regulatory or technical person in the regulatory authority, apart from my administrative duties. Now, when you look at a product, a medicine, even antiretrovirals, when I'm evaluating or looking at the data for antiretrovirals, I need to see evidence that it works. I need to see that it is well controlled in terms of quality, in terms of control of impurities, in terms of the manufacturing process, that this manufacturer has done validation that if this manufacturing process is followed within these parameters, we are able to get this product. And it's able to have an efficacy of this level, that it is effective in treatment of a certain disease. But not as it is today, that herbalists will just say, some of the herbalists that will just say that my medicine treats or cures all the diseases. It is not possible.
That is not possible. And I'll give you a chance to give us a bit more. We are almost due for a break, but Professor Oro wanted you to quickly tackle the question that was posed to you. Please go ahead before we take that break.
Okay. Thank you very much for that question. Yes, I would encourage herbalists to patent herbal medicines. But the process of patenting is not an easy process. And of course, you can't patent a plant because it's already on the public domain and everybody knows about it. Normally, if you are going for patenting, it has to be something new. It has to be something which can be commercialized, and you can give the process of preparation, which is different from any other process which has been done, so that the patent office can check all this information and give you a patent. So it's very, very difficult to patent, and also maintaining the patent, you have to pay a fee. So if we are there to share and treat the community, why look for patents? Let everybody use those medicinal plants and help the community.
Okay, thank you. Martin, I know you have some comments. I'll bring you in a bit later on together with Dr. Waraka, but I believe at this point we are due for a quick break. You're watching the Monday Report Town Hall session. We are live from the Panari Hotel, and we're talking about herbs. Do they work? Herbal medicine, has that worked in your case? 2242 is the SMS line. Hashtag is Monday Report. The program continues shortly. Stay with us.